Hello everyone and welcome back to my channel. So today I'm going to talk about a very important topic, and that is how to exactly read Robbins and what it goes behind reading Robbins. Now please understand that Robbins, should we read Robbins and why should we read Robbins? These questions comes first and then comes how, right? So today I'm going to take you through a method which will help you to read and retain Robbins in the best way possible. Probably you are not reading Robbins in the correct way, and for pathology you know that Robbins is the bible of pathology, and if you really need to master it, whether it's in your MBBS undergraduate or whether for Neet PG, everywhere Robbins plays such an important role. And towards the end of this video I'm going to talk about a very important announcement. So if you want to know that, then please watch till the end of this video. So starting with today's video, I want to first explain the importance of reading Robbins. Now before I explain the importance, I want to tell you something which I personally feel. This is completely my opinion. I personally believe that in your Neet PG exam or any kind of postgraduate entrance exam, what we do is we solve MCQs, right? And this MCQ exam is such a tricky exam that no matter how much you read or whatever kind of preparation you take, sometimes you're not really able to make it. And why is it that some students, they are getting the top ranks, and why is it that in spite of so much of effort, sometimes you lag behind? What is the reason? What is that fine line? I believe that not all the questions that you get in your exam you can mark it with full confidence. So a lot of the questions, at least 40% if not more questions, when you attempt in your MCQ tests, you attempt it from your gut feeling, right? Gut feeling is obviously a feeling which you get. You maximally get confused between two options or three options, and during the exam you hardly can arrive at a particular option, so there's always some confusion. And the only way that you arrive at a particular option is by your gut feeling, because you really cannot apply logic and think. You don't have time for that. You know that the paper was so lengthy this time, especially the second shift. It was such a lengthy paper, so even if you know, even like if you're at your home and you have plenty of time and you sit with those questions, probably you'll be able to do better than you did during your exam, because you have more time now. But in the exam, in that short period of time, you have to go with the answer, so you don't really have much time to think about it. So instantly you are going with the option which you feel is right, which is the gut feeling, which is your subconscious feeling. आपको लग रहा है कि नहीं यही होगा आंसर, तो you are marking and you're moving away to the next question. So this is gut feeling, and जितने भी students के, the students who get this gut feeling right will get a top rank, will get good marks, and a student who will miss out on this gut feeling will obviously miss on a lot of questions. So my idea behind this is what I personally feel, because I really introspected into the reason, because a lot of good students sometimes don't get good ranks. The effort, the perseverance, the hard work, there's so much goes into this kind of MCQ based exams, especially Neet PG and INSAT and FMG like exams. But still there are so many students who are so brilliant, who are so studious. In spite of that, they're not able to make it to the top. So this is one of the reasons, this is one of the explanations that I kind of feel is the reason that they have a much strong gut feeling. Now then I kind of try to understand, try to reason out why do these students have a much better and a stronger gut feeling. The answer to which I feel is the idea of concepts. ठीक है, तो गट फीलिंग के लिए जो जरूरी है वो है कॉन्सेप्ट, एंड दिस कॉन्सेप्ट बिल्डिंग डजंट हैपन ओवरनाइट. Okay, so students who have their basics concepts right and up to the mark, up to the level, these are the students who get their MCQs right just by their gut feeling. Even if they kind of have less time, they are missing out on certain parts of the question or whatever, when they are trying to mark the answer, they go with their gut feeling. When they don't have much time, they just go with their intuition, and then they get it right because they have a very strong base, they have a very strong concept. And obviously this concept takes place, the building of the concept takes place right from your first year MBBS. ठीक है, ऐसा नहीं है कि आपके पास में 3 or 4 या 6 months का टाइम है, उसमें इतना strong concepts बनना difficult है. So you have to study from your undergraduate days, you have to make your concept strong. I'm not asking you to ratify all the important points, that you can do later, बट कॉन्सेप्ट्स बहुत जरूरी है, जो एक बेसिक फ्रेमवर्क, फाउंडेशन, बेस, जो भी आप कह लो इस चीज को, दैट इज समथिंग विच यू हैव टू बिल्ड सॉलिड. ठीक है, and that is where exactly the role of Robbins is the most important. Okay, because Robbins is a book which gives you the ultimate concepts. ठीक है, इतने इतना इतना ज्यादा they have mentioned so many things in such fine details that you are just getting the concepts right. Even if you read other books like Harshmohan and all, you will understand it, but the concept is from Robbins only. That is why it is called the Bible of pathology. And pathology is a subject which is interconnected to so many other subjects. Every disease, every organ system, every disease will have a pathological basis, will have a base concept, and that concept is there in pathology, is there in Robbins. So once you master Robbins, the tables of Robbins, the flowcharts, the diagrams, once you're able to get hold of Robbins, I think any subject or any topic, any disease will be easy for you to read. Once you understand the pathology well, you will be also able to relate it to pharmacology, to physiology, and to medicine as well. So medicine में क्या होता है, the clinical features, the treatments, all of which are dependent on the pathological basis. So आपके understanding के लिए pathology से ज़्यादा important subject कुछ नहीं हो सकता है, ठीक है. एंड पैथोलॉजी में रॉबिन्स से ज़्यादा इंपॉर्टेंट कुछ नहीं हो सकता है, ठीक है. आई एम नॉट टॉकिंग अबाउट द पोस्ट ग्रेजुएशन में भी रॉबिन्स एक बहुत इंपॉर्टेंट रोल प्ले करता है. द बेस इज ऑलवेज एंड ऑलवेज रॉबिन्स, चाहे वो किसी भी कैटेगरी के स्टूडेंट आप क्यों ना हो. लेकिन पोस्ट ग्रेजुएशन में थोड़ा बहुत आपको ज़्यादा, यू हैव टू काइंड ऑफ बिल्ड a tall tower on that base, but in undergraduate you have enough time to read and master Robbins. And I will request you to go through Robbins in the second year itself, because you have ample time. You won't get this time later during your NEET PG. And once you go through your Robbins, please keep those areas marked, okay, so that during your NEET PG exam you can just brush up those tables and brush up those images and those points. Just make short review notes if possible from Robbins. And I will tell you that this will be so important. You will not even know, you will not even realize that you are actually improving. Your concepts are actually getting built up. You just can't see that. You just can't see that my concepts are getting built up, my concepts are getting stronger. You will not know that. But when you do MCQs, when you will write answers, when you will solve questions, that automatically will play an important role, irrespective of you realizing the importance of that. That is the beauty of reading Robbins in the right way and retaining it in the right way, making you having a strong base over pathology. And that will also give you a strong base of every other subject, including the vast subject of medicine. So medicine पढ़ने के लिए you don't have to read medicine only, you also have to read the surrounding subjects which plays an integral part in the subject of medicine. So this subject and this book is, is the gateway to so many important understanding and your exams, you understand. So I hope I'm able to explain you how important the importance of reading this book, and why is it that kind of the toppers and every teacher and everyone kind of encourages you to read this book. Okay, सो चाहे आप MBBS सेकेंड ईयर स्टूडेंट हो या फिर आप एक नीट PG एस्पिरेंट हो, रॉबिन्स एक ऐसा बुक है जो आपको पढ़ने की जरूरत है. स्पेशली फॉर द सेकेंड ईयर MBBS स्टूडेंट्स, यू हैव मोर टाइम, सो यू कैन गो थ्रू इट इन अ मोर एक्सटेंसिव वे and build your base stronger. Because as I always mentioned, that concept is equal to gut feeling in your MCQ. In some way or the other, each one of us have to go through an MCQ based exam, right? The tables, images, and flowcharts of Robbins are the gold mine of Robbins. Okay, that is the hidden treasure. That is the pearls of Robbins. The flowcharts, the tables, and the images. Sometimes direct questions are asked from these tables. Direct questions are asked from Robbins and also from the images. If not direct, at least some linked topics, some linked images here and there are always asked. Okay. So first, I'm going to address the MBBS second year students, and I'm going to take you through a method which is, for me, I think this is the only way, this is the foolproof ultimate method that you can apply to read Robbins when you're in a second year. Now understand that if you just take up Robbins and open it and if you just read it, you will not get the interest, or even if you get the interest, you will just read it like a story. You can do that. That is also a good way, because when you read Robbins, you get accustomed to reading Robbins, then it will be just a storytelling like experience. But that is also one way you can do. But what is more useful for you is that all of you will have your question papers, right? You have your last 10 years or 15 years of question paper from your undergraduates. What you can do is you can take up one chapter at a time, see what questions have come in the exam. Once you see these important questions, you have an idea of which are the important areas that you need to focus. You don't have to read the entire 100% of Robbins. You can read the most high yielding 70% of Robbins. That is the point I'm trying to make here. I'm trying to make a point that if Robbins is 100%, if you read 100%, it will be like a story reading experience. But the high yielding areas is only 70%. So if you read that, it is enough for you. And for NEET PG, 30% of that or 40% of that is the last minute revision topics, or during NEET PG preparation, you can go through that. So that is how it is distributed, I personally feel. So first, I would request you to go through the questions first, giving you a basic understanding of what is the outline of the chapter, which are the important areas, which are the important topics. And now when you open your Robbins and now when you go through those topics, you know that that this is such an important image, this is such an important topic, and I need to read this thoroughly, I need to remember this thoroughly. Okay. Along with that, what you do is you keep your Harsh Mohan or whatever book, extra book you are reading for your question answers, ठीक है, उसको आप साइड में खोल के रखो, and go through that also, and also go through Robbins then and there itself. So your answer, your question is completely getting prepared, your concepts are also getting stronger, your questions for your exams are also getting prepared. At the same time, also mark those last minute revision topics, especially the flow charts. Like in one chapter you may have 15 flow charts, or let's say 10 flow charts. All the flow charts will not be that important. Out of that 10 flow charts, maybe 5 are at most important, and you know that MCQs can be framed very much from here. So mark those 5 then and there itself, and you will be reading those when you'll be appearing for the NEET PG exam. So this is, I think, the most appropriate approach to reading Robbins. First, you should get hold of an overview of that particular chapter, because you know you need to know the importance of each topic, the importance of each chapter. All topics are not equally important, and I don't want you to get lost in Robbins. That then there is no use. To make the most out of Robbins, to make the most out of this book, you need to concentrate on the high yielding areas, okay, like any other subject. So then after you kind of know, get a hang of the important topics, then you read it, keeping the other book also side by side, preparing the answer and also getting your concepts right. At the same time, you should also keep those areas marked which you know will come for your MCQs, and then later on in your, during your NEET PG preparation or during your postgraduate entrance preparation, you can just open your Robbins and go through those particular tables or flowcharts, which will be very, very less percentage. Let's say 30% of the entire Robbins. So you can just go through that within a few hours itself, because you've already read it, you know it, you are just revising it close to exam. Also, if you want to go for any particular coaching institute or any particular notes, you can do that. I'm not asking you not to do that, you can do anything. But if you're just reading the coaching notes, then you're not getting the concepts right. You are just kind of knowing the points, because नीट पीजी में क्या होता है, हम सिर्फ चीजों को याद करने की कोशिश करते हैं, ठीक है, इतना सारा मटेरियल होता है, there is so vast material and so vast information that we kind of try to concise it and remember that much, लेकिन उससे concept building नहीं होती है, ठीक है. सो कॉन्सेप्ट बिल्डिंग के लिए रॉबिन्स पढ़ना जरूरी है, जो आपको सेकेंड ईयर में ही पढ़ना चाहिए, बिकॉज लेटर ऑन यू विल नॉट हैव मच टाइम. सो यू कैन डेफिनेटली गो थ्रू द नोट्स ऑफ योर कोचिंग इंस्टीट्यूट इफ यू फील, बट देन डूइंग दैट ओनली will not give you a proper base. So a very important alert, a very important message, that you should not read those notes only. You should definitely follow it up with your Robbins, those points, those chapters. You will realize that you understand it so much better, you are getting interest in this subject, and this subject, once you get interest in this subject, you will be able to correlate the various systems, the various topics, and then the entire medicine, the entire syllabus of medical science will become so much interesting and familiar to you, because you know the basis, you have a strong concept, you will automatically kind of get a hang of all these important lines by which you should ultimately read and retain. Okay. So this is for the MBBS undergraduate students, and now for the students who are preparing for the postgraduate entrance examinations like NEET PG and SIT, you should not go through Robbins extensively. Obviously not. If you have underlined and marked some tables from Robbins, only those are the areas that you need to go through now, because there's no time for you to go through it. So you would better go through the coaching notes, the concise notes, because now you don't have time for concept building. लेकिन concept जो भी आपके पास में है, उसको अच्छी तरह से इस्तेमाल करके आप notes जो है उसको पढ़ लो, और जितने भी underlined areas है और जो आपके टेबल से फ्लो चार्ट से रॉबिन्स के, उसको आप कर लो, ठीक है. नाउ देयर इज आल्सो अ काइंड ऑफ अ मेथड, एंड दैट इज you can just open the Robbins, and depending on your time, like for example, let's say if you are a NEET PG going student, you do have, let's say 1 year time or 1.5 year time, or let's say 8 months का time, जितने भी time आपके पास में है, you can just open the Robbins, just flip through the pages and go through the images and flowcharts only. Even if you have not marked it previously, even if you have not read it previously, you can just open the Robbins and go through the images, flowcharts and tables of Robbins, and not go through the text. This is what you can do if you are a NEET PG or any kind of postgraduate entrance examination going student. You can just go through Robbins in this way. It will not take much time. Those tables are really really important, ठीक है. कुछ tables ऐसे हैं जो बहुत important है Robbins में से, so you can just go through that. Even if you have not marked it before, you can just go through that. That will help you, because questions are sometimes directly asked from those tables. Okay. Now I hope that this kind of makes sense to you. Now coming to the most important segment of the video, and that is the announcement that I kind of wanted to make. That is, if you are not able to do any of these by yourself, then I am kind of bringing a series of videos that is Read Robbins with Me. So I'm starting this series of videos, which is RRWM, Read Robbins with Me, in which I'm going to take up a particular chapter from Robbins. I'm going to open the Robbins in front of you and take you through the most important areas of that chapter, highlighting the most important areas, explaining you the most difficult concepts, taking you through the images, the flow charts, which are of utmost important, and the tables, and giving you those areas which you need to keep in your mind, giving you an insight into the kind of MCQs that can be framed from those tables or from those texts or images. I am going to take you through the most high yielding areas of a particular chapter in a very concise way and a very fast manner, so that you have the entire chapter in a very concise manner in one video. To be very honest, I haven't seen any kind of video like this in the YouTube, in which the Robbins is made very easy. I haven't come across this kind of videos, so I decided to make this kind of videos. It is really a difficult journey, because you know that I'm in my second year, so balancing residency and self study along with making these videos and also editing them and finalizing them needs a lot of effort. But I decided to do it. Let me see how much and up to what length I can do it. I'm going to start off with general pathology first and post videos regarding each of this chapter. So I'm going to take up one chapter at a time, and I'm going to take you through the most important areas. So if you just listen to my videos and keep the books in front of you open, and you can just keep listening to me and keep underlining it and marking it, marking the MCQs, marking the important points and learning the concepts. I've also made some short review notes so that you don't get confused seeing those big flow charts. Sometimes you may get confused, so I have my own notes, short flow charts prepared by myself, which I've also incorporated into those videos. So let's see how much I can help you with this, and let's see how much you appreciate my effort. So I'm going to start posting these videos very soon. I hope that you learned something from me today. If you want to join me in the journey of reading and mastering Robbins, then consider subscribing to my channel. I will meet you very soon in my next video. Till then, take care, keep studying, and thank you for watching.